Well, the next speaker for the evening is Professor Asadul Zaman from Bangladesh. He is a Vice Principal and Head, Department of Oral Pathology and Periodontology, Soporo Dental College, Dhaka, Bangladesh, a PhD from Japan, a very highly learned doctor, and he would present basically how the dental colleges and guidelines have to be regulated. Welcome, sir.
Can I start?
Yeah, sir, sure.
Okay. Thank you, Dr. Puneet. It's my privilege for having us. So I have been listening to the wonderful presentations. All are related to how to open the dental clinics and what are the precautions we have to take to do the treatments. My presentation is totally on dental education. And still now, we are very much confused how to start the dental education. And students are around 4 or 5 months they were away from us. I'll be talking about the probable recommended guideline for dental colleges to be followed, and simultaneously to run the institution smoothly, we have to take care of the staff members, students, faculties, technicians. So I'm working as a vice principal and I have the Department of Oral Pathology and Periodontology Department, Sapporo Dental College and Hospital, Dhaka, Bangladesh. As you all know, the COVID-19 pandemic generated unprecedented challenge for the delivery of education to dental students. And this represents a need for innovative teaching and assessment method to prevent disruption to dental courses. In response to COVID-19, dental education faculty of different countries has quickly transitioned the entire pre-clerkship curriculum to online formats. As you all know that the students, dental students begins their courses with preclinical teaching, in which they receive teaching on basic subjects and its related laboratory and practical works. So basic science curriculums can be decreased while integrating clinical teachings within this time frame and revisiting the basic science later in the dental school. Remote access to live tutorial and the problem-based learning is possible through the use of video conferencing applications such as Zoom, Google Classroom, and Messenger, etc. As a substitute for anatomy laboratories, online level images for cadavers and pathology specimen pots can be provided. Microscopic view of histology, microbiology, and pathology slides can be provided in online. Videotape, vignettes, and mannequin simulator as a patient surrogate can be used. We can also take examination update on the online, updating our content materials. We can take exam by using ProctorTrack, webcam, or practicum. This is your online classes. We are taking in our institutions via Zoom. So clinical placement has been your cornerstone of dental training and since the early foundation of dental professions. As the number of cases of COVID-19 increases, dental students are not allowed to attend the clinic, representing a fundamental shift in clinical education from the bedside to online formats. Non-patient contact-based teaching may involve video conferencing applications and telehealth, consolidating and moving clinical didactic sessions online earlier to allow for later entry into the clinical environments, creating and using available virtual cases, modifying the academic calendar to extend later experience and defer clinical rotation, access to an online repository patient interview record and cases. And if to continue clinical teaching, priority of safety should be given. If patient contact-based teaching is to continue, adequate PPE and training must be provided, such as donning and doffing of the PPE. For smooth running of the dental institutions, the safety of the staff, students, faculties and technicians are very important. So in short, safety measure should include ensure masks to everyone. Masks should be provided to doctors, teachers, students in clinical placement and hospital staff according to their works. Ensure good quality PPE for outdoor and OT doctor and staff. Provide proper donning and doffing area for male and female respectively. Outdoor materials, those come in contact with the patient, should be disinfected in between the patient. Place hand sanitizer in toilets, classroom, halls, and near entry and exit where possible. Encourage frequent and thorough hand washing, at least 60 seconds. Clean and disinfect college and hospital building, classroom, if possible, frequently, particularly the surface that are touched by many people, like railing, door, teaching and learning aids. Should promote social distancing. Implementation of social distancing practice may include staggering the beginning and ending of the college and hospital day, canceling all events that create crowded condition, create a space for a student desk to be at least 1 meter apart, and develop a biosafety committee to monitor and maintain all this. This is how we are seeing patient in our hospital with the proper safety gear for the doctors. And the take-home messages are proper application and utilizations of e-learning and teaching methods and conducting an online obligations by updating the content materials, starting of academic activities in college in different shapes, continuing patient contact-based teaching by proper and adequate safety gear, modification and consolidation of dental curriculum to face pandemic situation in future. Thank you. Thank you very much for having me. Thank you very much.
Thank you, Dr. Asad. That you have, left us with a lot of food for thought because, there are so many dental institutions in South of Asia, and these
Yes.
recommendations possibly will come of use when these colleges are fully functional, and some of them are already functional, that how they should take care of their staff, their patients, and everything. Thank you very much, sir. We will come back to you as we move along.